Okay, so St. John's wort is also a Chinese herb. Historically, it's classified as an herb that clears heat from the exterior. All right, and the type of heat historically that it treats is the snake bite, the insect bite, the carbuncle, the furuncles, the sore, the aptus, and that type of things. And you can use this herb topically. You can also use this herb internally. All right. So the historical use of St. John's wort is somewhat similar to the historical use of this herb in Europe, which was used as an antiviral herb. Okay, but it's actually a more recent application for treating depression. Anyhow, what we found out is that St. John's wort actually worked very, very well with Chinese herbs, specifically with Yuezhi-1. And I think the reason is because St. John's wort has similar pharmacological effect as SSRIs, that it in fact increase the reuptake of serotonin, boosts the serotonin activity. So has that specificity. But like I mentioned earlier, anything that affects the serotonin to lift depression take about 6 to 8 weeks or maybe even longer. So St. John's wort is not going to be an overnight treatment. It takes a while. But the Chinese herb work on other part of the body. Pharmacologically, we may not know exactly why or how, but they work better and they work faster. So what happened is if you were to combine Yuezhi-1, escape restraint pill, with St. John's wort at the same time, you will find that the patient responds very well initially, and the effect will continue 6 to 8 weeks later and beyond as the St. John's wort kicks in, that you have immediate and long-term benefit. All right, so that's what we have found to actually be the best way to combine these herbs together. All right, so once again, if you haven't tried it, this is a great way to help to treat general patients with depression. Combine St. John's wort with another classic Chinese formula so you can get immediate and long-term effect. All right, if you do decide to use St. John's wort, okay, what happened is, because this herb has been used quite a bit, that there are two significant interactions that you need to be aware of. The first one is the exact mechanism of action, and that is because St. John's wort also increase serotonin activities. Try or do not use St. John's wort at the same time if the patient is still on the antidepressant drug, including Prozac, Taxol, Luvox, Celexa, Lexapro, and so on. Because if you have drug and herb that do the same thing and they are combined together, the effect may become too strong, where the patient may end up with serotonin syndrome. And the serotonin syndrome include sweating, tremor, flushing, confusion, agitation, and so on. All right. So the recommendation to avoid serotonin reaction is you want to leave 2-week period from the end of the drug to the beginning of St. John's wort. So that 2 weeks is to give enough time for the drug to be flushed out of the body before you introduce an herb that somewhat work the same. All right, and then what happens is, then you can use St. John's wort, then you can use Yuezhi-1. If the patient is afraid of going 2 weeks without any support, okay, then you can start the Chinese herb first, okay, and then 2 weeks after the drug is discontinued, then introduce St. John's wort at that point. Right. Another possible interaction is St. John's wort has been shown to induce cytochrome P450 system in the liver. Therefore, when you have a faster metabolism from the liver, you then metabolize other drugs faster. And when you metabolize other drugs faster, you end up with lower concentration and perhaps lower therapeutic effect from those drugs. And the drugs that may be affected, the list is quite a few. The ones I have here are the more significant drugs, because these drugs are more heavy duty. They are for treating more serious conditions, including cyclosporin, which is a immune suppressant drug, generally prescribed to suppress the immune system after the patient has gotten an organ transplant. All right. So as I describe these drugs, think about what the consequence would be if the effect of the drug is being suppressed, and therefore what the consequence would be. So if the drug is being suppressed for cyclosporin, there will be a higher risk of organ rejection. The second drug is combination of different hormones for oral contraceptive or birth control purposes. Once again, think what will happen, okay, if birth control no longer works as it's intended. Then you have theophylline, Theodor, and this is a drug for treating asthma. you have digoxin, which is a drug for the heart, and also imdanavir, which is a drug antiviral for HIV. So what would happen is if these drugs somehow do not work because of the interaction with St. John's wort, once again, you have very serious consequence. So generally speaking, if the patient is on any of these drugs, they really should not take St. John's wort. All right, but what happened in the U.S. is herb-drug interaction is a topic that not a lot of people address. So the ND may or may not be aware of it, an average herbalist may or may not be aware of it, and I would say the patient certainly has no idea. But what happened is St. John's wort is over the counter. All right, so if you happen to come across patient that is on any of these drugs, and you notice that they are on St. John's wort on their own, probably did not purchase that from you, because we really don't use St. John's wort as a Chinese herb, but they generally buy this over the counter. Make sure to counsel the patient on this particular interaction so they don't subject themselves to this significant risk.